Hello and welcome, everyone. We appreciate everyone for coming out today. So, this is our first webinar of the Provider Appreciation Week of 2020. So, today we'll be going over some updates from the Ryan White Parks. And as a reminder, please introduce yourself in the chat box. Just type your name and your agency. So, here's our session outline. And first, we'll have a day from the Part A program. We'll go through parts B, C, D, and have a Q&A. So just a reminder, if you have any questions during the presentation of each part update, just type your question in the chat box and we'll get to it once everyone's given their update. All right, so let's begin. Do you have anyone from the Part A recipient staff to go ahead and get the update for this program?
Good morning. This is Kelsey Giglioli from the Ryan White Part A office. I have a short update for you guys. We are continuing to work on our Ryan White Part A grant that is due in early October. So that is going to be our main focus for the next couple of weeks. We also are going to be doing our reallocation process coming up in October. So we are sending letters out to our providers this week to request any reallocation or sweeps money that they may need. We are continuing to, some of our providers have billed for their CARES Act dollars that we received a few months ago, but it took a little while to get everything set up and provide enterprise for our providers to bill. So we are getting invoices for our CARES Act dollars, and the majority of our providers are spending it on PPE and telehealth equipment and other protective equipment that their offices needed as a response to COVID. And those were the three things I have an update on, unless there's any questions.
All right, thank you, Kelsey. Well, if we have any questions, we'll get to them after the parts update. We're seeing right now in the chat box. All right, next, Josh, can you give the Part B update?
Good morning, everyone. So Part D actually includes two categories. We have the ADAP portion, which is part of Ryan White Part B, and then we have the services that we fund under the Part B category. We are the lead agency, the health department assisting agency for those funds locally. The grantee is actually the state of Florida Department of Health. So under the Ryan White Part B dollars, we fund medical transportation, eligibility services for Ryan White Part B, copayment assistance for individuals that might have an insurance plan that they pay for themselves, but they need copayments and deductibles paid, and it's not an ADAP approved plan. We also do emergency financial assistance that covers individuals for medications where their ADAP eligibility is not up to date, or we can also pay for rent. First and last, we cover some gaps when individuals are in the process of getting in HOPWA. We work really closely together with them. Also, we can pay in instances for electric bills or cell phone bills, depending on the need of the client. We also, under the medical line item, we're able to provide equipment. So if somebody needs, for example, trachs, or they need diapers, or they need oxygen tanks, all those things can be actually coordinated with the Part B program. And we receive the referrals from the Part A case managers, and there's a service delivery model associated with all of those. We also do nutritional supplements for individuals that might need it and they just need a prescription from the provider, and it's processed through to them as well. We spend the funds allocated to us 90 to 99% on a yearly basis. And we make sure that we keep track and that we move funds as needed for those categories, as some of them are underspent or overspent. One, I forgot to mention also the residential substance abuse program that we have a contract with. So that's on the Part B side for care, and then for the ADAP side, we do eligibility for ADAP. We have a pharmacy that we dispense medication for ADAP individuals, as long as some of them are actually not covered under the ADAP program under an LPAP. So their maintenance medications that might not be covered, we're covering them. So these individuals, they don't have to go somewhere else to try to fill those, because we already know that there's gaps when it comes to transportation for individuals. There's been 2 changes. One of them is that they have a program, ADAP has a program now that anybody that is, any pharmacy that participates with the CVS Caremark PBM can actually dispense medications that are not ARVs. Clients that might be in the weekend and they need an antibiotic, they can definitely pick it up for any of the pharmacies that are actually participating. Also, they can get their vaccines from a provider that is associated with CVS Caremark PBM, which is most of the pharmacies in Broward. Our mail-in program continues to grow. There's about over 1,300 individuals that actually get medications from us delivered by FedEx. And because of the grant that we got from Ryan White Part A and the CARES Act, we've been able to provide a lot of PPE for individuals and the people that live in their home, along with hand sanitizer to make sure that individuals are protected and stay safe when it comes to the COVID mitigation. And that's my update.
All right, thank you, Josh. For the Part C update, do we have Claudette Grant on the call? Okay, if not, we can move on to the Part D update with Biciola.
Hey, good morning, everyone. I was having some connection issues this morning. Is it possible if you could pull up the presentation I sent to you? Oh, wonderful. Yeah, because I'm having some issues with my computer. Thank you so much. Well, good morning once again. Oh, yeah, right there. We're good. Good morning once again. I am Biciola Fortune Evans. I am a manager at Children's Diagnostic and Treatment Center for our Comprehensive Family AIDS program, which is our Part D program. We are the only Part D program in Broward County at Children's Diagnostic and Treatment Center. So Part D basically is an HIV program that focuses on providing access to coordinated family-centered primary medical care, supportive services for HIV-infected women, infants, children, and youth, and their affected family members. Our approach with the Comprehensive Family AIDS program, which we call CFAP, we service the whole family unit, not just the person that have HIV. So if mom is positive and she needs support with assistance with her negative child with school or any type of medical assistance, we provide that approach at CDTC. Also funds for supportive services like case management, child care, and help clients get the care they need. At CDTC, we provide primary care, medical case management, psychosocial support for HIV positive women, infant, children, and youth, which I've already stated. So approximately we have 1,800 individuals in the CFAP program and 900 families for 2019. Nice. So here are support services in our clinical services and psychosocial services, pediatric HIV medical care, dental care for our children under the age of 23, and hygiene services, phlebotomy services, primary HIV specialty, and gynecological care with our adult clinic and our pediatric clinic as well for our adolescents. Adherence counseling, we do have a pharmacy on staff that assists our clients with family planning with our adult clinic, nutritional screening and therapy, risk reduction counseling, mental health screening, treatment and counseling, substance abuse screening and treatment. We do have a prenatal HIV medication counseling just for our clients that are enrolled in the CFAP program, and access to clinical trials for our research study. We're the only research site that is not associated with a university, and we conduct our research studies with our clients that are currently enrolled in our program, whether they're pregnant or adolescents that were exposed at birth, and we follow them throughout their elementary years and their adolescent years all the way until adulthood to see the effects of the medication. That's been a long-term study, but there's different type of studies that we're doing at CDTC. Intensive medical case management with our clients, psychosocial support, access to food, and gently used clothing. We have a very, very small pantry here for our clients where we have donated funds from the community. Support groups, which is well needed right now. Women's retreat, we do a women's retreat for our adult women, and we have one for our young adults as well. Children's camp, emergency financial assistance, which is all from donated funds in the community. Translation, we do have an access line that we service all clients, whatever language they speak, and childcare services during a visit. And we also try to provide transportation to eliminate that barrier with the clients, whether it is cab service or a bus pass. And we implemented the 50 and over exercise group with a personal trainer, and that's under Broward Health. And this actually idea came from our clients right after our women's retreat. They suggested that we have an exercising group to address all the comorbidities after you turn 50 or even possibly before. So we have a group of 4 women that go through a 6-week program, and then we transition to another group, and they're very excited about that. Next slide. COVID-19 pandemic. So there are some changes with our services, but our clients are still being serviced medical care wise to make sure they have full care they need during this time. So we've been open throughout the whole time. We're still doing test and treat for our Wiki population. We are doing much more telehealth than we've ever done before, visits. So if a client comes in for the initial appointment, their follow-up will definitely be telehealth. Sometimes it could be a little challenging with our clients that speak a second language, but we're working through that process if they need to come into the office. Dental services for adolescents. Limited medical care visits, which I've mentioned before, simply because of social distance. Our medical providers here on site had to rotate their schedule in terms of making sure that we don't have too much crowd at the clinic. So we do have a limited amount of slots. So we try to really make sure that our clients are coming to their appointments and not having any no-shows. Most of our staff, I want to say 80% of our staff are working from home to be able to address our clients' concern, especially with case management. We only have a limited amount of staff in the office. Intensive case management, which we are aggressively doing right now with a lot of our clients that are facing isolation during this COVID pandemic. And then we've increased our services with mental health counseling, which is being conducted through telehealth as well. Monthly food drives. We've been conducting monthly food drives. Our clients are coming into the parking lot and we're putting food into their trunks or in their back seats. So they're really appreciating that, and then providing them with gas card and a food card as well for additional items. We did have our regular back to school drive where we provide our clients and their kids school supplies, and that was also a drive-through as well. Our support groups are continuing with limited amount of clients that can participate. We have no more than 6 clients in a room, and the clients that are able to join via WebEx or Zoom. That's how they're connecting with us to be able to have support group. Medication adherence, especially during this time, is important. That's also been increased. And top-up services for our negative and our positive clients that are pregnant in Broward County. That's still been continuing right now. And it's very difficult with that program because it's mostly based on outreach. So we're really seeking some clients to join that program because we can't do as much outreach because of the COVID pandemic. So if you know anyone that is pregnant and living in Broward County that needs additional assistance, whether they're positive, HIV positive or negative, please refer them to the top-up program. And then financial assistance has been severely impacted by our clients. So we're trying to make sure that we provide that service to them, whether it's for FPL or water bill or helping them with their rental assistance. That all comes from donated funds. Next slide. And that's it, pretty much. And I think they're taking questions afterwards, but if anyone has any questions now.
All right, thank you, Viciola.
Thank you,
I guess
Marcus.
no problem. I guess before we move on to the Q&A block of the session, Claudette, are you on the call for the Part C update? Okay, and just had to check.
Yeah, I think, Marcus, I think the district, for some reason, the server has been lagging this morning because it took me a good 15 minutes to log on. So Claudette is part of the same system, so probably that's the reason why she's not able to connect.
Okay, thank you, Viciola, for that.
Yeah, no problem.
Okay, no worries. Okay, so we can move on to the Q&A block. If we had anyone with questions from any of the Ryan White parts, feel free to ask those now. You can type them in the chat box, or you can just unmute yourself and we'll take questions. All right, so at this time, I don't know if anyone's typing currently, but we don't have any questions thus far. So this brings us to the end of our first webinar for Provider Appreciation Week of 2020. We really appreciate everyone for attending. We have more webinars throughout the week, with tomorrow being motivational interviewing with Debbie Starr-Seifer. We have Wednesday on COVID-19 update with Dr. Eckert. On Thursday, we have a trauma-informed care session with John from Broward House. And on Friday, we have a poetry and HIV session with Pulitzer Prize winner Jericho Brown. So we implore you to come out and join these sessions. If you haven't done so already, please RSVP on our website in the link that we've sent out. And if you have any other additional questions, please let us know. And I see in the chat box from Glenette, the call was breaking up. So Kelsey, if you're on the call, we have a request for you to kind of repeat the first update or parts of it, the first parts, I guess.
Was there a specific part?
The first two updates?
Okay, so we're still working on our Part A grant. It's due either October 7th or 13th. For some reason, I can't remember the exact date, but it's due in early October for the Part A grant. So that's what our office is working on right now and is focused on. The second one was reallocation. So our priority setting and resource allocation committee is meeting next month to vote on reallocations, the sweeps process that we usually do for our Part A providers. So letters are going out this week from the Ryan White Part A program office to our providers to either request additional funding or to give back funding or say, let us know if they have an excess of funding that we could possibly sweep to other service categories. So that process will be happening next month at the PSRA committee meeting.
Thanks, Kelsey.
I also wanted to let everybody know that as part of the Provider Appreciation Week, we have put together like goodie bags from the Part A office for each of our providers. You know, if we were doing this in person, we would give them out to you while you're at the office. Unfortunately, the easiest way that we could figure out to do this now was to have one person from each provider office come in and pick up their goodie bag. So I will be in the office this week, Monday through Friday from 9 to 5. So if you want to send somebody from your office to pick up the goodie bag, we have several items in the bags for you guys. So just as part of this week, we would love if you could stop by and pick up your bag. And if you can't, then we will figure out a way in the future to either mail it to you or, you know, give it to you in person whenever that day may come. And the Broward Regional team will be sending out an email of that and giving you our address.
All right, thank you, Kelsey. And as one additional bit of information for those attending or those wanting to attend tomorrow's session on motivational interviewing, we are offering continuing education credits for that session. Okay, so if we have no more questions from the chat, which I don't believe we do, thank you everyone for coming today. We really appreciate it, and we hope to see you in our later sessions this week. We'll be in touch.
Have a good day, everyone.